The individual opinions of previous TIF procedure patients presented in this video do not reflect the opinions of Endogastric Solutions, Inc. and should not be considered as medical advice. Always ask your doctor about all treatment options, as well as their risks and benefits. Only your doctor can determine whether the TIF procedure is appropriate for your situation. While clinical studies support the effectiveness of TIF, transoral incisionless fundoplication, in treating chronic GERD, gastroesophageal reflux disease, individual results may vary. There are no guarantees of successful outcome. The TIF procedure may not be appropriate for every individual, and it may not be applicable to your condition.
My name is Chris, and I live in the mountains in Central California. I lead a very active lifestyle. I'm a PE teacher. I love going out and walking my dog. I like to jog. I'm a swim coach and a volleyball coach, and when I try to exercise with my kids or do workouts with them, I would feel almost physically sick, and for a couple days afterwards have to recover from that. The reflux affected my life very severely. I think I was very depressed at times. I would have lots of symptoms in my chest and in my throat. I couldn't enjoy the things I used to do, and like going out to dinner with my husband, having a glass of wine. I just had to be so meticulous about what I ate. And I was taking my medication twice a day, and it was barely keeping it under control. I had this fundoplication procedure done. I went into the hospital. I had the procedure done on a Thursday, and I went back to work on Tuesday. My life now is so much better. I'm not having to take the medication. I can drink coffee. I can drink orange juice. I really don't think about what I need to eat. Dr. Schwartz actually said to me, Chris, just eat what you want to eat and drink what you want to drink. I can go for walks with my dog. I can ride my horses. I just feel like a weight's been lifted off my shoulders, and that I can enjoy life again and the things I enjoy doing.
All surgical procedures have risks. Therefore, it is important to understand the associated risks. Before you decide on a procedure, speak to your physician in detail about the risks and complications that may occur. Expected risks or discomforts as a result of an endoscopic procedure include sore throat, left shoulder pain, temporary abdominal pain which can be treated with standard pain medication, temporary difficulty swallowing due to swelling, and nausea or vomiting. These expected events occur in more than 25% of people who have the TIF procedure. They are usually mild in severity and resolve themselves shortly after surgery. The TIF procedure may be right for you if you are at least 18 years old, have symptomatic chronic GERD, require and respond to pharmaceutical therapy, have a hiatal hernia less than or equal to 2 centimeters, and have a BMI less than 35. The TIF procedure may not be right for you if you have a bleeding disorder, chronic cough, stricture, severe esophagitis, esophageal diverticuli, an obstruction, a paraesophageal hernia, limited neck mobility, osteophytes of the spine, esophageal varices, esophageal infections or fungal disease, or esophageal stenosis. The procedure may not be right for you if you have anatomy that would prohibit insertion of the esophagus device, if you cannot adhere to the post-operative diet recommended for appropriate healing, are under 18 years old, have a hiatal hernia greater than 2 centimeters, have a BMI greater than 35, or are pregnant. Your physician may have other criteria he or she uses to determine whether you are an appropriate candidate. Ask your physician to discuss those criteria with you. To find a physician that offers TIF near you, visit gerdhelp.com. That's GERD help.com, and use the physician locator.